Welcome to Module 5, the clinical rotation and specifically the clinical day. This module is the heart of the course, so please make sure that you have your logbooks readily available to you so that you can jot down your ideas in your I will log and your thoughts in your clinical reflection log as you work through the material. In this module, you'll be hearing from both faculty and students, and I'll be asking you to stop the presentation and listen to the separate video presentations from Dr. Benner, Carol Thorne, Dr. Kimberly Silver Dunker at UMass, and Dr. Pam Ironside and her faculty at Indiana University. So after this slide, please pause the video so that you can listen to the video presentation from the student's point of view. I hope you enjoyed that brief video from the student's perspective about the importance of their clinical experience. The purpose of this module is to provide you with an overview of the total rotation, a guide for planning the clinical day, and what you should be doing during the clinical day. Please access the Clinical Toolbox module for tools and strategies to help you and your students stay organized. By the time you finish this module, you should be able to describe specific elements of the clinical classroom environment that impact teaching and learning, select some methods for making student assignments, have an idea about how you plan to conduct pre- and post-conferences, decide on at least one method that you will use to help students demonstrate reflective practice. You should be able to discuss methods that you'll use in order to maintain patient safety. And finally, you should be able to describe at least one method to encourage students to demonstrate higher level thinking. The NLN competency for this module is number 1, facilitate learning. It states that nurse educators are responsible for creating an environment in the clinical setting that facilitates student learning. And this is just a portion of what this competency states. Just some of the highlights. It states that the educator implements a variety of teaching strategies grounded in educational theory and evidence-based teaching practices. He or she engages in self-reflection and continued learning to improve teaching practices and uses information technology skillfully to support the teaching learning process. The educator practices skilled communication to convey ideas and models critical and reflective thinking. Further, the instructor creates opportunities for learners to develop their critical thinking and critical reasoning skills. He or she demonstrates respect for the learner and develops collegial working relationships with students, faculty, colleagues, and most especially, clinical agency personnel to promote positive learning environments. And most importantly, the instructor serves as a role model of professional nursing. The agenda for this module follows the same format as all the other modules. Please complete the audiovisual portion of the module, read and review the handouts and the articles. This module is packed with reading resources and videos. All of the suggested material is relevant to building your teaching strategies for clinical teaching. And finally, please reflect on the module's content, complete the reflection questions, meet and discuss the reflection answers with your mentor, and then complete an evaluation of the module after you've had a discussion with your mentor. Here are your reading resources for this module. You can see that you have some articles that are listed here that can be used in both this module as well as the Clinical Toolbox. You have Beck's article, Curtis's article. There's also one very similar written by Bott, which is on your Resources tab, which is very good for the 1-minute preceptor or 5-minute preceptor, however you want to think about it. And then White's article is excellent, talking about the just-in-time type of preparation that students can do for the clinical day. The textbook, Gaberson, I've selected chapters 4 and 5 to support you in this particular module for the clinical day. On this slide, you'll see the links to the videos that are embedded within this course, as well as some supplemental videos for you. Here are your supplemental readings as well as additional cues and learning modules, and the bot article that I was just mentioning to you on the 5-minute preceptor, which is excellent. Earlier I mentioned the clinical toolbox module, so I encourage you to go to the clinical toolbox module when you're looking for strategies to utilize during the clinical day. I wanted you to think a little bit about the clinical classroom. Why is the student there and why is the patient there? Two very different reasons. And also, what does the clinical environment feel like and sound like? If we were to read the perfect classroom situation, what would it be like? And we would say that it needed to be quiet, we don't need a lot of distractions in the room, those kinds of things. But that's not our clinical classroom. The patient is there for health care, of course, and our students are there to learn from the patient and their experience in taking care of the patient. This instruction is carried out in a very public, sometimes very noisy, and usually very chaotic environment. We of course are there because we want our students to gain the knowledge, skills, and the appropriate attitudes for being a nurse. Our overarching purpose is to bridge that didactic or classroom learning to the clinical experience, and then of course to learn the role of the nurse, become socialized into the role of a nurse. So how can we bridge the didactic to the clinical experience? I suggest that you review the didactic and skills lab syllabi for the time period for the clinical experience. Look at the scope and sequence of the skills the students are learning there. While you can introduce new skills to the students, make sure your expectations are in line with the teaching plan of the semester. As I've mentioned before, it's extremely important for your expectations to be appropriate for the student's level and progress in the nursing program. Some instructors are so excited to share new and exciting opportunities with the students, fearing that these opportunities may not be available again, and that might be true. Therefore, if you do place a student in an area that may be ahead of their teaching plan, you must be sure to properly prepare with the expectations of what you expect the student to gain from the experience, and then debrief the students. Have them journal about their observations so that you can see what they learned from the experience, and then clarify any misperceptions should there be any. And it's been my experience that it is really easy for the untrained eye, as in the novice nursing student, to miss as well as misinterpret the opportunity. Additional things that you can do are to help the students and their classmates tie things together from the previously learned material. Ask them to tell you how they think that this can be done. Remember that it's more than show and tell. It's more about show, tell, interpret, and then integrate what they have learned. You can review previously taught didactic and clinical skills so that you know what can be built upon. And then make student assignments that will reinforce the didactic instruction as well as the skills lab whenever you can. When you start to put the rotation together as well as each day, it's really important to have goals and objectives for each day. Do they necessarily need to be written down as an official objective? No, but you should have a good idea of your plan for the day. And remember that the first day and any subsequent days, as well as the last day, do not need to be the same. You need to look at your course procedure sheet and your expectations for the rotation, and of course go over those on the first day with your students. We know that in nursing, each and every day is fluid. We can't control everything that happens all along the day, so we just keep going and going. So it's important to always have a backup plan should the census be low, or the staff's too busy, or there's something else going on the unit which is preventing you from making the traditional student assignments. Of course, the other thing that you do is make student assignments. The instructor is responsible for making the assignments, but the way that you assign students things to do, you may take their input, or you may allow them to have the freedom to make their own assignment once, and then they of course check that with you. Other things that you do, you may collaborate with the charge nurse on making the most appropriate assignments for students. And as I mentioned, students could make their own assignments. You can also have assignments where you make peer-assisted assignments where they can work in pairs, or one is acting as a leader or in a leadership role. So what's our role as the instructor? First and foremost, as the research supports, students are looking to us to be the role model, to role model professional practice, to work by nursing ethics, and to develop trust. It's our responsibility too to maintain patient safety and student safety. We have to practice using very clear communications between both the student and the staff. We have to follow our expectations for students. They should have been clearly stated to the student, and then we need to follow through. Of course, in the beginning, we develop our course procedure sheet or our expectations, and then the key points are that we manage each clinical day, we look for learning opportunities for our students, we are the resource for our students, and then we also develop a plan for giving our students other resources. We are the liaison between the staff and the students. We observe the students' patient care, their assessments, individual patient care encounters, procedures. We observe them giving medications to patients. We lead conferences. You give feedback throughout the day, as well as at the midterm and final evaluations. Students report to their instructor their plan for the day and throughout the day. Instructors encourage students to think about what they're learning, and we'll talk a little bit more about the teaching strategies of using scaffolding questions, encouraging evidence-based care, encouraging students to practice using sound clinical reasoning and judgment. We provide the encouraging support. At the same time, keeping our hands off, if at all possible, allowing that student to do the patient care. And of course, as I mentioned just a moment ago, we're looking for those bridging opportunities. So what's the student's role? Students should come prepared, on time, rested, in the correct uniform, with all their supplies per the nursing program guidelines. And if there was preparation work that was assigned, then it should be completed before beginning the clinical day. Students need to be open-minded and willing to take on new responsibilities and procedures per their current scope of practice. They should be aware of their own boundaries, knowing what is and is not included within their current scope of practice. And according to Beck, nursing students report that the initial clinical experience produces the most anxiety of any clinical day. To help students through their first clinical day, faculty must understand the meaning of this experience for them. In her study of 18 undergraduate nursing students, they described in their writing an experience that they had during their first clinical day. And here's what she found. Students reported feelings of being overwhelmed with anxiety, feeling abandoned, encountering reality shock, envisioning themselves as incompetent. They were doubting their choices of becoming a nurse, but there were a few that had some uplifting consequences of their first day. I'd like you to read this article because you'll find some ideas to help students get through this first day. Some of those suggestions were to just, this comes from me, ask them how they're feeling. Let them know that they do not need to be perfect, she says. They are just beginning. You can pair students, which is a great way for them to have support in any new clinical area, not just on the first clinical day. And also, during the post-conference, ask them again how they are feeling, and then assign a journal assignment for them to vent their feelings. And this can also help you to address things that students may not want to vent in front of their classmates. There's a link on this page, a student's reflection of the first day. It's written by a student not so long ago attending Oregon Health Sciences, and I think it's really insightful to hear what she has to say. I must admit that I never really thought that much about, I knew that they were nervous, but I never really thought that deeply about how students were feeling. But I think by understanding how they're feeling, it can help us to be a little more supportive as we begin each clinical rotation. And I couldn't help but think that some of these feelings you also might be feeling as a first-time clinical nurse instructor. A couple of comments that came out of this student's reflections were, everything is new and everything is difficult, as well as there is a lot to learn in a very short amount of time. And these are both very true statements. So what happens during a clinical day? We've talked a little bit about this as far as what the instructor's role is, which is very much about, I added the information about what you do during a day, but in general, you provide the plan, you have a backup plan, you make student assignments, and remember that these student assignments, they can be specific care type assignments. They can be maybe, depending on the level of your students, maybe you just want them to take vital signs. Maybe you want them to do something else specific to the assessment. And there is a tool that I put in the clinical toolbox that's by Caputi, where she gives a plan for a focused clinical experience. You can also pair students, as I mentioned earlier. You can have some alternative assignments, perhaps to a different unit. And I'll give you an example of that in just a moment. One of the things that I did was something called Journal Club. I assigned the students to look up evidence-based articles and have those in reserve if we had a low census day or a period of time in which students were all caught up with their care and they wanted to have just chit-chat time, but I wanted the time to be productive. And I felt this idea really helps with that. And then of course we do pre and post conference and providing feedback throughout the day. We know that each clinical day does not need to be the same depending on the length of the rotation, as well as depending on the objectives and the clinical site. The first day is a great day to do a general walkthrough of the unit, meet the charge nurse and many of the other regular nurses and staff. And I mean staff. You need to know all sorts of people that we work with when we're working in the clinical area, not just the other nurses. Show them where the bathrooms are and the cafeteria and where they can get a drink of water. What are your expectations for them if they want to go to the cafeteria? Do you all go together? Do you assign lunch times or break times for them? This is, it may be in your expectations, but this is where you make sure that they understand what's appropriate once they're in the clinical site. Maybe there's a break room, maybe there's not. Where will you usually meet them before each clinical day? Point that out to them, or maybe you've already had them meet there on that day, on the first day. You can have a scavenger hunt after you orient them to the general area. The tool for a scavenger hunt is in the clinical toolbox, and of course you can ask your mentor to look it over and make it more specific to the unit that you'll be working on. You can make this scavenger hunt as short or as long as you like, and after you've done it the first time, you may want to alter that to make more sense for the way for the information that you think is the most important. For instance, when I first started, it had a list of supplies and rooms, etc., like that, but I started adding other information, like where do they find the phone number for dietary, and where do they find the phone number for another area that oftentimes students were calling to get more information, specifically the pharmacy. I think the scavenger hunt is fun for students, and it really lightens the mood and kind of brings it down and makes them a little bit more comfortable with the surroundings, especially if they've never been in this particular facility. So let's talk a little bit about student assignments. Is there any preclinical day preparation? Pre-patient care activities. Here are some of the tasks that many instructors require of students: to obtain their assigned patient information, prepare a care plan or a concept map, look up their medications. But the question is this really practical anymore? And is it practical on the unit in which your students will be practicing? For most inpatient acute care facility patient stays anymore, they're very short. And all too often, students have completed all of their prep work the night before. They arrive completely prepared, and they find that their assigned patient has been discharged. Now what? Well, of course, they receive a new patient care assignment, and then they have to complete all their prep work right there and right now. So the question is, if they can do it that way, then why should we continue to have them do all the prep ahead of time? There's an article that I've asked you to read, and in her article, White agrees. So I suggest you read this to get a little bit more depth. She says, you know, we still need to go over the medications, the plan of care with the student, as well as review the lab data. And students get much faster at getting prepared when they do it on site. And I'm thinking, isn't that what we as nurses have to do? We don't get our patient care assignments the night before. One of the strategies that I did in my obstetrical clinical was to give the students a list of medications that were most often administered so that they could look them up before the rotation. This was about 20 medications or so. They then kept this information in their journal and they could refer back to it, but I always still made them look up the medication again in a drug book on the unit before they gave the medications. Is this duplicate work? Yes. Do they need to do this? Probably. So you're going to have to use your own judgment as well as the level of the students to get a feel for what you think is the best way to go about this situation. Preclinical conferencing, beginning and the end. We all arrive on the unit or to the facility depending upon the directions that you have given. Once everyone has settled down and they're all centered, you will discuss the plan for the day. What are the priorities of care for this particular day? And depending on this, you will make the student assignments, unless you've already done that the night before, and that's of course depending upon the clinical setting. Of course, make sure that all the student assignments are understood and that the expectations for their clinical assignment are understood. Have the students tell you their plan. This helps to reduce their anxieties. If you can, encourage the students to think about what they're learning, but this may be more appropriate at the end of the day. However, if the student is going to another unit, as I was mentioning earlier in this module, make sure that they understand the goal or the objectives for going to that site. If the student is rotating from med-surg to the pre-op area of surgery, what are their objectives for that day? What are they doing? Are they observing handoff reports? Are they there to practice IV starts? These suggestions may seem simplistic, but I can assure you that students may not know why they're going to an alternative assignment. You want them to gain the experience that you had intended for them, and yet if they do not understand, they may not. So I strongly encourage you to keep your pre-conferences succinct. Get your students on the floor, preparing to care for patients. Time is limited, and while discussion is very helpful, actual hands-on is the purpose of the clinical experience. Let's talk a little bit about the different types of clinical assignments that you can make for students, and they can range anywhere from observational to total patient care, or they can be focused care or a focused role, so they're focusing on the charge nurse role. They can rotate to a different unit, and I've mentioned that already, going from med-surg perhaps to the emergency room or to the pre-op area. You can concentrate on medication administration only, or only on patient assessments, or even following the wound care nurse in a long-term care facility. They can concentrate on communication skills, listening or giving report, as well as taking report. They can practice the SBAR technique for communications, and I have a video for you to see later on in the module. You can give them a specific journaling assignment following a specific clinical assignment, and later on in the module I'll talk about a focused assignment using the word safety. All the assignments are made, so now what do? Well, you look for additional student learning opportunities. It's not unusual to have another staff member come to you from a different department or a nursing staff member and suggest that they have a great opportunity for a student, and then it's your responsibility to make the determination on whether or not you want to reassign a student to go to a different department or observe a procedure with one of the other nurses that they might not be working with. It's very important that you make rounds frequently on the students. Observe and review their clinical skills. And communication cannot be emphasized enough. You need to know where the students are, and they need to know where you are or how to contact you. The staff nurse needs to be kept in the loop too. Who's doing what? The staff nurse needs to know what the student is responsible for, what the student will not be doing relative to the patient's care. For example, if the student is a first-year student, is not capable by skill level or scope of practice to care for the IV or IV medications, the nurse needs to know that the student will not be doing anything relative to IV therapy or IV medications. You need to get report on the patient's progress from the students, and the student needs to give report to the nurse before they leave the floor, before meal breaks or the end of the shift. I know that seems like a given, but the students don't always understand that concept. It's very important to hear what the students are thinking. I know it's very tempting sometimes to do a lot of the talking, but we need to remember that we need to hear what they're thinking and let them talk. As far as medication administration, we need to directly observe students giving medications many times until you are comfortable that that student is capable of giving medications without direct observation. Sometimes the nurse will be the one who will directly observe the student giving the medications. I think it's the faculty's responsibility to review the medications that the students will be administering. You may or may not need to be directly observing, but you need to have reviewed those medications with the student to be comfortable that they understand the precautions that they need to take when administering medications. As far as data collection, you can work with students on how to navigate the medical record to look for the information that they need. What information do they need? Is the patient taking potassium? What laboratory data do they need? That might be something that is an example of how you would work with a student. Has the patient had surgery? What lab data might you be curious about before getting the patient up to ambulate for the first time? Cueing the student as to what data they need to be looking for. And then doing some working with students on lab work interpretation. It's important, I believe, and many others say the same thing, that students should not be recording laboratory data as within normal limits, because they're still learning what normal is. And even though the computer may read the results as normal, I think it's very important for students to be doing some comparing from, perhaps in a surgical patient, the pre-surgical laboratory data with the post-surgical laboratory data. Even if both lab results are, the computer thinks, in the normal range, there's such a wide variety of a hematocrit that the patient could still be symptomatic from a dramatic change, and both may still be recording as within normal limits. So it's important for you to help the student to see that you don't just read what the computer has to say. You actually look at the numbers and then look at your patient and see what's really going on. So you can help them to provide them feedback throughout the day with these kinds of things, with questions that they have, with the care that they are rendering. And of course, this feedback needs to be given positively, in a positive way, frequently, and many times in private. And of course, the other thing that we'll be doing as we work through the rotation is doing the feedback that we would do throughout each day would be considered formative, whereas at the end of the rotation we will be conducting a summative evaluation, as well as at midterm. We kind of sum up what's happening about halfway through the term and then give them some guidance on where they might go in the future. And I'll talk more about that in the evaluation module. I've included next a video that comes from the CUSN Quality Safety Education for Nurses website, and the title of it is Managing the Complexities of Clinical Instruction. What I like about this module is that you can hear firsthand a very seasoned clinical instructor sharing her struggles in the teaching in the clinical area and how she goes about making clinical assignments and where she used to be and where she is now. Our nursing ethical code of conduct says that patients are our first priority. So when we think about students caring for patients, I think we need to ask ourselves, are the students safe? Have they demonstrated the skill or the procedure in the skills lab successfully? Is the student prepared? So these are the things that you will need to use from your own judgment. Do you feel confident in the student? When I say is the student prepared, what I mean is that you can ask the student to walk you through the steps of whatever procedure they're about to perform. If they're able to talk themselves through that procedure and you're comfortable with that, then of course let them or allow them to go forth and do that procedure. If they can't, I would not allow them to do the procedure. Have them go back to the policy and the procedure book, have them review the procedure, and then have them talk you through it again and see if you feel comfortable. You don't have to let them do that procedure just because it's available to the student. The nurse is there to care for the patient, so you don't have to allow them. Now, having said that, the whole purpose of being in the clinical area is allow the student to do those clinical skills. So if we hold them back, they're never going to progress either. So that's that fine balance that you as the clinical instructor will be walking with a student. Are they impaired? Are they too tired, or do you feel like they're under the influence of a medication or alcohol? You need to make that call, not necessarily to diagnose whether they're under the influence of a drug or alcohol, but the School of Nursing has a policy and you need to follow that policy. But remember, if you think that the student is impaired, you may not want them to drive home. I have had the experience where a student came too tired because they had worked the night before. The School of Nursing has a policy about working too close to the time of arriving for clinical, so you need to review that policy. What I did is I sent the student home, and then I was worried, oh my goodness, were they too tired to drive? But I did do that. The student was safe enough to drive home, but too tired to be in the clinical area. You can review the CUSIN website for more information on maintaining safety in the work area or in the clinical area. There are two high-risk, error-prone activities that occur in every clinical day for us as nurses and with students, and they are communications and giving medications. For this reason, I have included two videos created by Dr. Kimberly Silver Dunker. Both of these videos are available on the CUSIN website as well as the UMass where she works. Dr. Dunker has given me permission to include them here. In the first video, Dr. Dunker works with a student using SBAR as a communication tool for talking with the staff nurse. And I'd like you also to observe how she talks with the student. I think she does a great job of demonstrating respect for the student and at the same time maintaining her leadership role as the clinical instructor. In this second video, Dr. Dunker demonstrates how she works with a student giving medications, how she has the student talk her through the medications, and how she corrects some of the misconceptions about medications. I think that's very important. Again, maintaining the respect for the student. Notice how she specifically tells the student that she's not going to take over the care. Also, see how she puts her hands in her pockets. I think this is a great tool to help her to stand back. Not all students need to administer medications every clinical day, as it may be too difficult to facilitate, especially in a long-term care facility where the residents may have as many as 20 or more medications. So what happens at the end of the day? The post-clinical conference. Have an agenda or specific items to discuss. The post-conference is most often a time to discuss and reflect on the specifics of the clinical day. Give students specifics to help them bridge the didactic and the clinical learning. You can have the agenda be free-flowing too, with an opportunity for students to share their patient assessments, their patient care that they render during the day, any new experiences, or something new that they learned today. And that actually is your agenda for post-conference. If you want everyone to share, then you'll also need to put a time limit for each student so that everyone can talk and you can still finish on time. Because remember, that's a part of trust, so that students understand what time the clinical day will be over. And if the end of the clinical day is somewhat flexible, then letting the students know that ahead of time will really help with their trust of you and the process, as well as their attendance, if you will, in the post-conference, because they won't be constantly looking at the clock wondering when they're going to get finished. You can also tie their observations and experiences to the evidence, or can they? Or to their didactic. Another option is for students to give a presentation, such as prepare a brief overview of a patient care scenario or condition, and it can be presented as a care plan or a concept map. What is the evidence? Is there a need to change practice? Is there a safety issue? Generally, a post-conference doesn't last any longer than 1 hour, and not every clinical day needs to have a lengthy post-conference, but that's your call, depending on the clinical rotation that students are having. I do think that it's very helpful to gather all the students together so that you know that they're all off the floor, because you really don't want to leave anyone behind, because you will be leaving the building. Secondly, it's usually nice to have a quick wrap-up, and you can give the students some guidance on what they might be looking for in the next clinical day. Also, you can make sure you remind them of your expectations for their post-clinical assignments, their reflective journal assignment as an example. I've attached a PowerPoint outline created by Dr. Marilyn Orman, and she has some ideas about post-clinical conferences too. Talk with your mentor about ideas for post-conferences and what do they use. Another option for post-clinical conferences are to have the students work on their critical thinking, their clinical reasoning, and you can talk through a particular patient with them. So one student can give a report on a patient that they cared for, and then you can then work with the entire group as they work through the appropriate care for this patient. And in the next video, you'll see Carol Thorne doing this with her students, and it's very, very powerful. Here is an example video clip from Dr. Benner's website, Educating Nurses. This video is a great example of how the clinical instructor, Carol Thorne, demonstrates the use of leading or scaffolding type questions with students to help them with their clinical reasoning and thinking. Using scaffolding questions is a strategy that Carol used in the preceding video. And according to Cognitive Apprenticeship, scaffolding is defined as the support the master gives apprentices in carrying out a task. This can range from doing almost the entire task for them to giving occasional hints as to what to do next. Fading is the notion of slowly removing the support, giving the apprentice more and more responsibility. And I think this perfectly describes our role in the clinical area. In this particular strategy, we're talking about using questions rather than actually hands-on experience, or using our hands in it. We're actually trying to get the student to think or use their clinical reasoning skills by using scaffolding type questions. And it's really fun. You really don't know what the student is going to say when you ask one of these questions, so it's very free flowing. And sometimes you can get a little bit stumped as to, what might I ask next? And I think if you look at the video again, if you haven't already seen it in that first time, you'll see Carol trying to think about what should the question be so that she can get the student to come to the next step or to make that conclusion that she's thinking of for the clinical reasoning portion. You can have a lot of fun with this. Clinical reflection in nursing is gained through discussion and through journaling. You can give specific assignments for journaling. It can be free-flowing about their day, or you can have a specific objective. In the clinical toolbox, I discussed the tool developed by Rayfield and Manning in 2006. It's the safety tool. And in the article by Russell et al., they discuss how they used the safety tool to assist students with deepening their clinical reasoning skills. I've attached the article by Russell to this module, as well as the tool and the article are in the clinical toolbox. I think using this tool can help us as instructors in a couple of ways. First, the tool helps both the student and the instructor by giving us a template from which to work. Secondly, it helps us as instructors to better define clinical reasoning when we hear it. It helps us to grow in our skills of being able to hear it and see it so that we can better work with the students that are having more difficulty. So take a look at the tool and the grading rubric and see if this is something that you could implement with your students. It might be something that you can use as a final learning activity, as it's pretty involved. However, it seems like a good habit for the students to get into when they are reflecting on their patient care experiences. Additionally, I have assigned for you to read the article by Tanner. Using the evidence, she developed a model of clinical judgment, which is discussed in the articles by Lassiter and Nelson. Tanner reminds us that reflection can help students to both expand and develop their clinical knowledge and reasoning. Her model has 4 aspects, which she named noticing, interpreting, responding, and reflecting. Tanner's model, together with Lassiter's grading rubric, makes a reflection assignment for students a great learning tool, and at the same time, this assignment is also easy for you to offer feedback, which can further strengthen the student's learning. Now it's time to bring it all together. And when I looked at the 1-minute preceptor tool, it seemed like the perfect way to do it. The tool brings everything all together for the student in the clinical area: questions, feedback, and reflection. Curtis really hits the mark with her statement, learning in the clinical setting is a complex phenomenon. This tool packs all the learning frameworks together in an easy-to-use strategy. This is your strategy or formula to help the student work through their decision-making and clinical reasoning. In step 1, you ask the student to give you their assessment. The student explains the patient's condition, maybe gives you a verbal conclusion of the patient's condition or the results of their assessment. In step 2, you offer scaffolding questions to elicit the student's rationale for their assessment conclusion. And then in step 3, teaching general rules, you would help the student connect the dots about their assessment and rationale. You might have to give them some more information through the questions you ask so they can put the data together. Maybe they forgot to add patient teaching or the rationale for the patient's medication. Of course, this depends on the context of the problem or the risk that they're talking about or the plan that the student started with. If the student is able to give all the correct information, of course, this step is unnecessary. Step 4 is where you reinforce everything that the student did correctly, even if they made some errors. Start with what was done correctly so that they know how or what they should be doing correctly the next time. Lastly, correct any mistakes the student made. Perhaps they forgot to look up some collaborating lab data, or an important aspect of the assessment. So the most important takeaway in the process for me is to remember to be specific in your feedback, not just good job. And I must admit, I have been guilty of forgetting this important tip in giving helpful feedback too. And just a sidebar, if a student is really struggling and you're having a hard time deciding what they did do right, take a moment and see if you can sit down with a student and ask them to help you with this part. Ask them, how do you feel about it? Whatever it is that they did. And then, you can fill that in. Then ask them, what parts of the procedure do you feel good about? Now this might help you to see if the student can self-evaluate accurately, and it also gives you a place to start with the positives. Then have the student tell you where they think they could have improved or what could have helped them to perform this skill or procedure or assessment better in the future. Now you can emphasize your own assessment for the student along the way as you're talking with them. Following this slide, there is a brief demonstration of the 1-minute preceptor tool in this short little video clip that was created by a nursing instructor. Here are some CUSIN learning modules that you can take a look at for your supplemental learning. In this module, we talked about planning the clinical day, making student assignments, and some teaching strategies that can be used during the clinical day to assist students with their clinical thinking, whether we call it critical thinking or clinical reasoning. It's really about the ability of the student to learn to prioritize patient care, doing what needs to be done, and this can only be learned through experience. We want students to be able to critically think about the care a patient is receiving, as well as what needs to be done and when. I'd like you to be able to reflect on the following questions and discuss your thoughts with your mentor. Should you have any of your own questions, of course, please share them with your mentor too. And jot your answers down in your reflection log. And I hope that you've had the opportunity or you've thought it was important enough to jot down some thoughts in your I will log. Here is the link to the Educating Nurses website created by Dr. Patricia Benner. These are resources that she developed. Not all of the resources are completely free, but you are free to look at some previews of the videos and participate in some of the continuing education learnings that are listed on the website. The website is relatively new, so I'm sure it's going to be continuously growing. So I encourage you to check out the website and sign up for her free newsletter. The evaluation for the module is next. After you've completed all of the videos and the reading assignments and had an opportunity to talk with your mentor, I hope you'll come back and finish the evaluation of the module. Thank you for joining me on this module. I know this was a lengthy module, however, this is the heart of what you will actually be doing with your students. The additional thing that you will be doing will be performing this student evaluation, and that will be in your final module coming up next.